Hi, Todd Martin here with The Walking Code. In this video, I'm going to describe how to walk upstairs without pain. So many people get pain in the front of their kneecaps when they move upstairs or also when they move downstairs. This isn't a problem that just happens with much older people. People can start getting this problem even as early as their 20s. I see this in my patients all the time and also in people that I just know personally. The problem with pain in the knees with walking upstairs is one of improper function, meaning we're not moving upstairs in the correct manner to keep our kneecaps lined up properly, and we're not using the proper muscles as we move upstairs. This is what causes increased pressure in the kneecaps as they push into the femur bone that leads to pain. In this video, I'm going to show how to move upstairs in the correct manner that will help you prevent pain or reduce pain. I'm going to begin with some basic tips that anybody can use to help walk upstairs without pain. The first thing we need to think about when we move upstairs is keeping the knees in proper alignment. The first part of that alignment is going to be over the ankle, so the knee is not too far towards the inside or to the outside. If my knee is too far towards the inside of the ankle, which is the most common problem, the knee cap is not going to move up and down on the femur with proper alignment, and that's going to increase the wear and tear and pressure in the kneecap that ultimately leads to pain. The other common problem is shifting the knee too far forward over the toes, so that also increases the amount of pressure into the kneecaps when we try to push up. When we walk upstairs, we need to look at 4 separate components. Each one of these components needs to be performed correctly in order to move upstairs with the proper technique and with the proper alignment of the knees and the spine. The first component is placing the foot on the step. The second component is rooting that leg to the step. You see how my foot came down to a flat position. It's now rooted on the step. The third movement is to push up with the rear leg to get my body weight completely over the standing leg, and then the final fourth component is to push up with the standing leg on the step. I then start the cycle over again by placing the next foot on the higher step. During each component, we need to make sure the knee alignment is proper and also that our spine is aligned, meaning remaining completely vertical, not leaning forward. It's a common mistake to lean forward over the step to try to get the center of mass over the standing leg so you can push up in this position. This puts extreme amounts of pressure into the kneecap. When we move up the stairs correctly, the spine stays vertical as we place the foot, as we change weight, as we shift the weight onto the step, and then we lift up and place the next step. There's no leaning forward necessary, and at all times the knee should stay over the ankle or slightly forward, but never in front of the toes. The knees will move in front of the toes if we lean forward to try to move up the stairs, and I can already feel the pressure going into my kneecap when I do that. The first component of moving upstairs is placing our swing leg onto the step after we approach the step initially. So I'm walking, and I need to stop my center of mass from moving forward and then place my foot on the step with the heel. So you notice the toes of the foot are still up in the air, and I'm still rooted to the ground on my back left leg. I don't yet have any root on the right leg on the step. I've simply moved forward, stopped my center of mass moving forward, and then placed my foot on the step. That's component number 1. Component number 2 is to change the root from my leg on the ground to the leg on the step. Right here, my leg is rooted on the left side. You can see I do not have any root on the right. What I need to do to change my root to the right leg is use my lower abs to tuck and pull my weight forward and up slightly. That brings the toes of my right foot down to the ground and changes my root to the leg on the stair. At this point, I'm still not ready to push up with my right leg. I'm still pushing back with my left. In order to get my weight fully onto the stair with my center of mass over my ankle, I need to use my upper core to turn in the direction of this forward motion, and that brings all of my weight onto the step, and then I can push up. The common problem, well, I'll say there's several common problems, but one problem is trying to push up from this position. Right now I have no leverage. My center of mass is way behind my standing leg and my standing foot, and so I cannot push my body weight up at this point. This is where people start to pitch forward in order to get the weight over the standing leg and the standing foot. That's not what I want to do. What I want to do is shift my root first to the stair. I'm still pushing off the left leg. Then I want to shift the rest of the mass onto the stair by continuing to push off with the left leg and rotating the core so it shifts my body weight forward. Now my center of mass is completely lined up over my standing heel. Now I can push up with the glutes on the right leg to finish the lifting component of the step. That now pushes the body up, extending the hip as well as extending the knee until I'm reached my full standing position. At this point, I'm going to tuck my pelvis on the left side again, and now I can place my foot back on the step to keep going. If you haven't already signed up for the Walking Code online course, please click on the link below the video and that will bring you to the website so you can sign up. It is a great course that can help you learn to move more fluidly, move with more confidence, and ultimately move without pain. Thank you for watching.